everybody. I am Warren Lesnevsky, Product Marketing Director here at Cotiviti. So welcome and thank you for joining us on Cotiviti's quarterly program Integrity Pulse client webinar. We're pleased to have also opened up this webinar to other health plans today because it's a special event because of the subject matter, and that subject is catching potential drug testing fraud. We're also honored to have one of our client payer organizations joining us today. We'll introduce him in just a moment. With that, I'm going to turn it over to Erin Ressler, our VP of Fraud, Waste, and Abuse, and she's just going to say a few words and introduce our speakers. So take it away, Erin.
Thanks, Warren. Good afternoon, and thank you again for joining us today. Today's webinar will highlight one of our many success stories in collaborating with our incredible health plan clients. Specifically, our presenters will showcase how our partnership yielded positive results through coordination, thorough analysis, and most importantly, a close collaboration between our two teams. I'm thrilled to introduce our speakers today, Sean Mullen and Carlin Hoffman. Sean Mullen is the Director of the Special Investigations Unit at MetroPlus Health Plan. He served 21 years as a Special Agent and Supervisory Special Agent at the FBI, where he led the FBI's New York Healthcare Fraud Task Force and served as the Program Coordinator for the New York office's Healthcare Fraud Program. In 2019, Sean received the Management Award from the DOJ's Criminal Division Healthcare Fraud Unit. Sean is also a distinguished military graduate of the Army's Reserve Officers Training Corps and served as a commissioned officer in the Army Reserve, advancing to the rank of Major. Sean is a certified fraud examiner and accredited healthcare fraud investigator. Joined with him today is Carlin Hoffman, one of our many talented senior investigators on our Cotiviti FWA team. In this capacity, she performs data analysis to identify potential fraud, waste, and abuse, prepares statistically valid random samples, creates audit findings reports, as well as law enforcement referrals when appropriate. Carlin also has experience surveying both members and referring providers, as well as conducting both post and pre-payment investigations. And now let me turn it over to Carlin to kick things off. Carlin?
All right, thank you so much, Erin. I'd like to welcome everybody to our webinar today, and we're going to be showcasing a real live urine drug testing fraud case to show you some of our collaboration and techniques that were able to yield to a successful overpayment in this case. So before we get started, I do have to, of course, read you this disclaimer. The contents of this presentation, both written and oral, are not to be construed in any way as legal advice. This presentation is for informational purposes only, and the views and opinions expressed are those of the presenters and do not necessarily reflect the official position of MetroPlus Health Plan or Cotiviti. All right, so now that that's out of the way, let's get into what our objectives are going to be for today. So as I said, we're going to be using a urine drug testing case, and through the lens of that case, you're going to learn how to use data outside of your four walls in order to engage in information sharing, and then also how to use link analysis to examine relationships and connections with known bad actors. The second objective for today is to be able to identify outlier providers using peer comparisons. And then finally, we'll discuss how to perform a thorough medical review in order to generate an audit findings report. So let's go over our agenda. Sean is going to be kicking it off, and he's going to give some background about MetroPlus and Cotiviti and our partnership. And then we're going to delve into our case study, and that's going to be an end-to-end case study on a New York-based laboratory. We're calling them ABC Laboratory just for purposes of confidentiality. And we're going to present the case all the way from the receipt of the tip through to the subsequent data analysis, the medical review, and then the ultimate audit findings report and overpayment demand. And we hope that through the lens of the case study, you'll learn how to leverage information sharing to generate referrals. And I'll also be covering some data analysis techniques to help you analyze the members' data holistically and make sure that the members actually had visits with the listed ordering providers within an appropriate time frame. So investigations should never be conducted in a silo, and we're going to be demonstrating how we were able to conduct link analysis and identify referring providers who were known bad actors. And while referrals obtained from information sharing should always be given due consideration, it is very important to analyze the data and make sure that the allegation is supported by your health plan's data. So I'll be demonstrating how to use peer comparisons to verify that your provider is indeed an outlier. And then lastly, we'll talk about some red flags that we found in ABC Laboratories medical records that you should be on the lookout for as you're conducting medical record reviews for your own drug testing investigations. All right, and now I will hand it over to Sean.
Thanks, Carlin, and thanks, Erin, for that very kind and introduction that you gave me earlier. Happy to be here today. I was speaking with some of the team beforehand, and this is my fourth presentation with Cotiviti, and always happy to speak to the great work that's being done in our partnership here. MetroPlus Health has been contracted with Cotiviti since 2017, so we're now entering our 6th year of our FWA services contract. And for those of you who don't know about MetroPlus Health, we are a wholly owned subsidiary of New York City Health and Hospitals, and that's the largest municipal health system in the United States, which is dedicated to preserving and improving the health and lives of New Yorkers with its integrated health system. So Health and Hospitals is the public hospital system in New York City. So those of you who watch the news or crime dramas have probably heard of Bellevue Hospital. Elmhurst Hospital was on the front lines of the COVID outbreak, and our cities are sort of the first line of defense when the pandemic hit. And MetroPlus is the health plan that's associated with New York City Health and Hospitals. And I've been with them since 2019 after retiring from the FBI. So a little bit more about MetroPlus Health. We have over 633,000 members, 12,000 providers at over 30,000 sites. We have over a dozen health plan offerings. The bulk of that is managed Medicaid, but we also have Medicare, managed long-term care, special needs plans in the areas of HIV, Child Health Plus. We've got some private lines of business, small business lines of business, and since last fall, we brought behavioral health in-house. So that's a new offering. Not a new offering for us, but it's been a challenge for us to bring in-house. And as those of you who are with payers know, whenever you offer a benefit in-house, the amount of work that comes into the SIU just blows up. Specifically to our MetroPlus SIU, we're a small operation. We're a small shop. There's 2 employees, myself, the director. We have a senior investigative analyst, and those of you who are with private payers, it's hard to do that yourselves. So contracting with Cotiviti has been a force multiplier for us. It's given us a deep bench. We have probably about a half a dozen investigators assigned to our contract, but as those of you again in the private pay space know. The payer space know you need a deep bench of auditing staff, additional resources, which you're limited from a budgetary perspective and the things you can do. So the partnership that we've had with Cotiviti since 2017 has yielded tremendous benefits. And from a resource perspective, again, it's a force multiplier. It enables you to take on so much more than you can with the limited staffing that sometimes your plan will provide. So again, we have an FWA services contract, a full services contract with Cotiviti. The platforms that are indicated in color are the platforms that we take advantage of here at MetroPlus. So we use Sentinel, the post-payment detection program. We use Informant, which is an investigative analysis and predictive models system. And then we have a case and workflow management platform called Commander. And that's our case management system. So that's the shared portal platform that we have with Cotiviti to manage our cases and to ensure that the work is going from lead generation all the way through to hopefully settlement negotiation or outward referral. And the opioid crisis. I mean, I spent a lot of time working these types of cases when I was at the FBI, going back to the early 2000s when you could still get an OxyContin 80 milligram tablet that did not have a protective coating on it, which the fraudsters soon learned to defeat anyhow. But opioids have not gone away. It's just, they've taken, the whole crisis has taken different forms. So we all know that the opioid crisis in the United States has taken a terrible toll. In the last 12-month period ending in April of last year, there were 100,000 overdoses. That was an increase of over 28% from the 78,000 deaths the same period the year before. Most of those overdose deaths are related to synthetic opioids. Fentanyl, everybody knows about the problem with fentanyl these days. But fentanyl is not just an illicit substance that's brought through. There's prescription fentanyl that you can get, the old Actique lollipops, those of you who remember those, the transmucal transmission of fentanyl, and then there were patches, and it's evolved over time. You had Subsys, the sublingual spray. So there's been prescription fentanyl. Not all fentanyl is illicit, but the stuff that grabs the headlines now is the stuff that's coming across the border, the stuff that's manufactured overseas, and that's taken a tremendous toll on the lives of American citizens. So all sorts of deaths have increased related to illicit substances, but fentanyl's the big problem. Semi-synthetic opioids such as Percocet, OxyContin, those types of things or oxycodone are still taking a tremendous toll. New York City, obviously, we're very hard hit from opioid and drug overdose deaths, and every 4 hours, someone in New York City dies of a drug overdose, and that takes more of a toll than homicides, suicides, and motor vehicle crashes combined. And again, they're related to at least 85% of all overdose deaths in the country. And fentanyl obviously grabs all the headlines, but there's a lot of prescribed substances which are taking their toll as well. As a health plan, we try and do what we can to educate our providers regarding opioid prescribing guidelines, and we also have internal policies and procedures related to that, as well as urine drug testing, which we're going to speak about today. So, Carlin, back to you.
Yep, thanks, Sean. So, as Sean was saying, obviously the opioid crisis has really taken a toll. And so Cotiviti and MetroPlus have been sort of prioritizing these investigations, especially when they could involve member harm. So now we're going to go ahead and dive into our case study on ABC Laboratory. And again, this is not the provider's real name. We are giving them a pseudonym to protect the innocent or not so innocent. Okay, so many of you on the webinar may use our software and services. Some of you may use our software without services, or some of you may use another vendor entirely. But regardless of what software you're using, by the end of the presentation, you may want to consider including a services approach too. So Cotiviti has a unique advantage as a vendor company, especially when we have multiple client health plans in a similar geographic area. And we're able to leverage industry knowledge by applying the trends and the schemes that we see in our client data in order to pursue those untapped schemes for our other clients. And then for providers that have a countrywide patient base, like durable medical equipment, genetic testing, laboratories, telemedicine, those sorts of providers, we will often see the same providers that are billing multiple Cotiviti client health plans in the same abusive ways. And then when Cotiviti's clients have members in overlapping geographic areas, we can often hit the ground running when we have a new client that goes live by having a pre-established list of known bad actors who Cotiviti has investigated previously on behalf of other client health plans. So in this case, we were able to leverage our knowledge from having previously investigated ABC Laboratory on behalf of a second New York-based Cotiviti client health plan in order to create a tip for MetroPlus. So, obviously, while a case against a provider by another health plan is not in and of itself reason to launch an immediate investigation, information sharing across plans is an excellent source of case tips. And while it's better to be proactive than reactive, it's also important to leverage external resources like press releases or referrals from outside agencies like the DEA, OPM, OMIG, OIG, and the Medicaid fraud control units. And it's also important to refer your own cases.
Oh, yep. Yeah. Oh, I'm sorry. Yep. I had to talk over you. I just say it's a great point. We're all siloed in our own shops, looking at our own geographic regions, unless you're with a nationwide payer and dealing with a company that's got nationwide accounts, or participating in working groups or information sharing sessions is absolutely key to being on the front line of learning new schemes.
Yep, absolutely. We really can't overstate enough the benefits of information sharing, and sometimes working with a vendor company who has multiple client health plans is a great way to facilitate that information sharing. So in this case, MetroPlus received a notification via a press release from the New York Division of the Drug Enforcement Administration that concerned a pain management provider who was ordering drug tests to ABC Labs. So that press release from the DEA had two prongs. And the first prong implicated a pain management provider who we are calling Dr. Pillmill. And he was indicted for charges that included criminal sale of a prescription for a controlled substance, healthcare fraud, and also scheme to defraud by unlawfully selling prescriptions. So the prosecutors alleged in their indictment that Dr. Pillmill and his co-conspirators prescribed nearly 4 million OxyContin pills in a period of 5 years. And then the prosecutors also alleged that Dr. Pillmill was inducing patients to submit to medically unnecessary tests that were then billed to Medicare and Medicaid by prescribing those patients OxyContin for no legitimate medical purpose. And then the second prong of the referral implicated an employee of ABC Labs who we'll call James Doe. And prosecutors alleged that James Doe was falsifying the results of drug tests in order to remove evidence of positive tests for illicit substances that would have precluded the prescription of opioids. So after we received this DEA press release that implicated Dr. Doe and Dr. Pillmill, Cotiviti expanded the investigation of ABC Laboratory to conduct a link analysis of the referring providers. So there are a lot of moving pieces in an investigation, and it's very important that you look at the big picture. So link analysis is the process of examining and visually presenting the connections between providers. And remember, referrals are a very large piece of the puzzle, but they're not the only piece. And in this case, the DEA press release alleged that there was an inappropriate referral relationship between James Doe, who, remember, is an employee of ABC Labs, and then Dr. Pillmill. So at this stage in the investigation, I wanted to see who else was referring to ABC Laboratory, and I also wanted to verify the allegation that Dr. Pillmill was referring patients to ABC Labs. So I ran a query in Cotiviti's query engine to pull all claim lines billed by ABC Laboratory, and then I summarized my data set by referring provider. And I also analyzed the tax identification numbers because some of my referring providers billed under the same tax ID. So it's often helpful to conduct online research of your target laboratory so that you can find high-level employees like the CEO, chief financial officer, chief medical officer, etc. And at Cotiviti, we use a subscription service to an investigation software on behalf of our clients so that we can perform background checks and examine potential known associates. And it can be very helpful to conduct background checks on high-level employees of your lab. The next thing that it's important to do is take a look at the referring providers and see if your plan has any providers who are already under investigation. And Cotiviti offers a case management tool that allows users to export the project directory, which contains the subject provider MPI. So we have multiple investigators providing services to MetroPlus, so it was important for me to check and see if any of my colleagues had opened any investigations on any of the referring providers whose names might not have immediately rung a bell to me. And as you can see in the link analysis chart, Cotiviti had already opened an investigation on Dr. Smith, who was one of the top referring providers to ABC Laboratory. And though Cotiviti did not have an investigation into Dr. Jones, Dr. Jones and Dr. Smith were employed by the same group, which we saw with the shared tax ID. So it's important to be thorough in your link analysis so that you can identify and examine all of the possible connections. And at Cotiviti, we're really striving to break through the silos and collaborate with our colleagues and our clients in order to conduct holistic investigations. So it's important with link analysis to keep in mind that not all links between providers are created equal. So I've created this pie chart on the slide to show the percentage of referrals that originated from each provider. And then the providers designated with an asterisk are providers who were already under investigation. And then in this pie chart, I've also created a catch-all column for all of the other providers that were outside of the top 10 referring providers, because ABC Labs had over 300 unique providers ordering drug tests. So as you can see from the final pie chart, patients referred by Dr. Pillmill comprised 14% of the drug testing referrals made to ABC Labs. But provider number 2 and provider number 5 were also investigated by Cotiviti. So it is a red flag if you have a laboratory and several of their top referring providers are already under investigation. And it's just certainly something that warrants further analysis. And while it was definitely important to determine the percentage of claim lines referred to ABC Labs by each of the referring provider, it was also important for us to determine who else Dr. Pillmill, which other labs Dr. Pillmill was ordering tests to. So to obtain the data for this pie chart, I ran a query in Cotiviti's query engine and obtained a data set of all of the drug tests that listed Dr. Pillmill as the referring provider. And then I just summarized my data by referring provider, MPI, and then presented it graphically. So when we looked at Dr. Pillmill's full member history, we found that he referred over 2/3 of the patients that he referred to drug tests to ABC Laboratory. So this pie chart and then the pie chart that was on the previous slide are telling two very different stories. Because on the previous slide, we saw that there were a plethora of other providers other than Dr. Pillmill who were referring to ABC Laboratory, but Dr. Pillmill was referring over 2/3 of his drug testing patients to ABC Labs. And that was a huge red flag. It's not typical to have a single lab comprise such a large percentage of the tests that a provider orders. And that could imply an improper referral relationship, which may or may not involve kickbacks. But either way, it was something that certainly warranted further investigation. So we talked about how to identify your top referring providers, but just because a provider is listed as the referring provider on the claim form doesn't actually mean that they ordered the test or even that they saw the patient. So it is important to conduct your own analysis to verify that these members have a corresponding visit to support a referral having been made. And Cotiviti has a lead generation tool that has a rule that flags providers who bill for laboratory tests without a corresponding face-to-face visit with a qualified health professional. And ABC Laboratory flagged on this rule. If you don't have a similar vendor tool, you can use a query engine to look for this billing pattern once you've selected a lab for investigation. So in this case, I started by creating a filter of member IDs who received drug tests from ABC Laboratory. And I used that filter as a parameter in a query to find any E&M visits received by those members. So you should expect to see an E&M visit in the coding range of 99202 through 99499 on the same date of service as a drug test. And providers should report the specimen collection date as the date of service for the laboratory test, not the report date. So typically, referring providers will collect the specimen, which in this case is a urine specimen, from the patient in their office, and then they'll ship the specimen to an outside laboratory unless they're doing a point of care testing and performing the lab service themselves. So the drug test date of service should usually be the same date of service as the evaluation and management visit, but it is important to keep in mind that particularly during COVID, some of these E&M visits may have been rendered via telemedicine, in which case the provider may have asked the patient to present directly to the laboratory for specimen collection. So even if that's occurring, you would still expect the E&M to occur within a few days of the specimen collection because the provider needs to be using the result in the management of the patient's care and needs the results as soon as possible. So for our Cotiviti clients, you can run a pattern 11 to identify encounters where the same patient received an E&M within 7 days prior to a drug test. If you don't have a similar vendor tool, you won't be able to detect E&Ms within 7 days, but you can still run an advanced filter to detect E&Ms that were billed on the same date of service as a drug test once you've exported your data. So after I ran my pattern, the resulting data set contained all of the drug tests billed by ABC Laboratory for which the patient did have a corresponding E&M visit no more than 7 days prior to the drug test. And from there, I simply worked backwards in order to obtain a list of all of the drug tests for which the member did not have a corresponding E&M within 7 days prior to the drug test. And those claim lines were considered to be at risk because there's no E&M that suggested that the drug test was actually ordered by a qualifying health professional who was treating the patient and using the test in the management of the patient's care. So that billing pattern is concerning based off of applicable federal and state drug testing guidelines.
Hey, Carlin, I just wanted to add, I mean, that's anybody who's worked narcotic investigations, from a prescription standpoint, you need that face-to-face interaction with the provider, every month. And you're right, COVID did change the methodology in some ways. But, reputable physicians are going to want that 30-day visit. They're going to want to be checking their prescription monitoring programs, according to state guidelines. Before issuing that opioid prescription. And obviously the drug testing, complements that whole process. But if you're not seeing the face-to-face interaction or, the telemed interaction, that's an absolute red flag when you're talking, drugs of this strength.
Yep, exactly. So, as Sean said, there are, that is definitely a big red flag. So when we saw that, our investigative staff, we discussed this billing pattern with our medical review team, and our investigative staff does continuously collaborate with the medical review team just to take a look at the billing patterns and see if providers are billing in ways that don't appear to be in line with applicable federal, state, or plan-specific guidelines. And then in this case, our team pointed MetroPlus to some guidelines that demonstrated the need for drug tests to be ordered, which ABC Laboratory was potentially not in compliance with. So New York Medicaid has guidance that says that routine standing orders are not reimbursable and that drug tests have to be ordered by a treating clinician. And then regardless of what state your health plan is in, you can always refer to the Code of Federal Regulations, or CFR. And 42 CFR says that tests that are not ordered by the physician who is treating the beneficiary are not reasonable and necessary. So based off of these guidelines, it's cause for concern if your patients don't have a corresponding visit with a qualified practitioner in order to substantiate that an order for the test was made. Okay, so before we get into the nitty-gritty of the case, let's just take a step back and give you some important background information about drug testing. So the first step in urine drug testing is known as the point of care, and it can also be called presumptive or immunoassay testing. So this type of testing returns a result of either positive or negative to indicate the presence or the absence of a drug or a drug class. It won't give the specific drug and it won't give a quantity. And if the presumptive test returns unexpected or inconsistent results, confirmatory testing may be indicated. And confirmatory testing is also referred to as definitive drug testing. So definitive drug testing results will indicate the specific drugs and their metabolites, and it will also give the quantity. And definitive drug tests can be billed either for individual substances, which would use CPT code range 80320 through 80377, or they can be bundled into panels of drug classes using HCPCS coding range G0480 through G0483. And for the panels, it's important to note that each panel is in increments of 7 classes, not substances. So G0480 is 1 to 7 drug classes, G0481 is 8 to 14 classes, G0482 is 15 to 21 classes, and G0483 is 22 or more drug classes. So this graph shows the clinical diagnostic laboratory fee schedule that was established by CMS for drug testing panels. And as you may have as you may have expected, the presumptive drug testing panels are significantly more cost-effective than the definitive panels, as they reimburse at a significantly lower rate. And then the larger the definitive drug testing panel, the more that a provider is going to be reimbursed. So a panel of 1 to 7 definitive drug tests that's billed with HCPCS G0480 on average might pay $114, but a panel of 22 or more definitive drug tests will pay $246.92 on average. So this provides a motive for providers to bill the definitive drug testing, and you should be on the lookout for providers who are billing the larger definitive drug testing panels at a much higher rate than their peers, because this might be, an inappropriate effort to obtain more reimbursement.
Yeah, and that's obviously incentive. If you just look at what the reimbursement rates are, there's obviously a tremendous financial incentive for the providers to bill the higher cost tests. And if it's an undue percentage, then obviously, like Harlan says, it's a red flag. I believe our policy and procedure refers to them as qualitative and quantitative, as opposed to presumptive versus definitive. But that's just what our policy calls them. But if you have too many of the higher end, then it's usually not entirely necessary unless there's other indicators for them to say, all right, well, I need to explore this a little further. But that should be the exception rather than the rule.
Yep, absolutely. And we certainly appreciate the role that drug testing plays in keeping the members safe, but it is still important to make sure that care is cost effective.
Absolutely.
So now we're going to go over some guidelines on when definitive drug testing is clinically indicated. Medicaid and Medicare have both established guidelines on when definitive drug testing should be billed. And the National Government Services, or NGS, has put forth a local coverage determination, or LCD, on urine drug testing. And MetroPlus uses the NGS LCD because the Wisconsin Physician Services LCD is applicable to all but 3 states, one of which happens to be New York. But both of the LCDs are very similar, and what they effectively boil down to is that definitive drug testing is indicated when the presumptive urine drug test yields an unexpected result, or when there is no adequate presumptive test available. And we also refer to the New York State Medicaid Program Manual, which says that only substances that return a positive result on a screen or a presumptive test, or are inconclusive or inconsistent with clinical presentation, are reimbursable with quantitative testing using CPT code range 80320 through 80377. And then definitive or direct confirmation testing using CPT code G0480 is only reimbursable when no screening method is available. So now we're going to talk about using peer comparisons to determine if your provider is an outlier. And the main purpose of conducting peer comparisons is, of course, to determine and identify outliers. So this can be an effective data mining tool to identify providers that might warrant additional analysis, or if you already have a provider in mind to investigate, it can help bolster your case. So Cotiviti's lead generation tool offers several different types of peer comparisons. And if you have already identified a provider for investigation, you can view that provider's top paid codes and then compare the percentage that each of those codes comprises as compared to the provider's peers. But if you're still in the data mining phase and don't have a particular provider in mind that you want to target, you can also view the top 10 providers by payment for a specific procedure code, and then also see the percentage of payment and claim lines that procedure code comprises as compared to the provider's peers. So for drug testing, it's often beneficial to find the top paid provider for the largest panel of definitive drug testing, which is HCPCS G0483. And it is important to consider both the total paid amount and the percentage of payment. You might have a scenario where a large national lab might have a very high paid amount for G0483 simply because they have an enormous patient volume. So it is important to look at that percentage of payment, because if it's below the peer average, it's probably not worth looking into. But in the case of ABC Labs, HCPCS G0483 was accounting for 48% of the provider's total payment from MetroPlus. And then comparatively, the average lab was deriving only 3.8% of its payment from HCPCS G0483. So this data suggested that ABC Labs might have been billing for blanket definitive drug tests when a presumptive test might have been adequate. So another way that our lead generation tool is able to run peer comparison reports is to show a list of procedure codes, which you can custom select with a filter by specialty. So I use this filter to filter by drug testing panels so that I could compare ABC Laboratory to its peers for only drug tests. So a lot of labs bill drug tests as only a small component of their codes. So I conducted this peer comparison as a way of eliminating the non-drug testing panels so that I could get a better picture of the provider's billing. And we talked about the highest paying definitive drug test, GO483, but it is also important to look at the other panels because sometimes providers will try to fly under the radar a bit by billing the second highest panel because it's a little bit less obvious. But ABC Laboratory just went straight for the jugular, and they billed 50% of their definitive or of their drug testing panels with HCPCS GO483, which was not really what we saw with our peers at all. And then another important note in these peer comparisons is to take a look at what the peers are billing that your provider isn't. And in this case, the average lab was predominantly billing the more cost-effective presumptive drug testing panel with CPT 80307, whereas ABC Labs was billing significantly more definitive panels. And then ABC Labs was barely utilizing the smallest definitive panel, GO480, which is 1 to 7 drug classes, but the average lab billed GO480 as the majority of the definitive panels. So anytime you see that your provider's peers are predominantly billing a lower paying code, but your provider is billing the highest paying code, that's a big red flag. Okay, so we talked about the drug testing panels, but definitive drug tests can also be billed using individual substances, and that would be CPT code range 80320 through 80377. So on the right side of the slide, you can see an excerpt of what was, if you'll believe it, a single patient encounter billed by ABC Labs. And so this patient received 28 paid definitive drug tests. And remember, according to New York Medicaid, only substances that return an unexpected result are reimbursable for individual confirmation testing using CPT code range 80320 through 80377. So within the confines of New York Medicaid guidelines and local coverage determinations, this billing pattern doesn't seem to be above board. And if we were to request the medical records for this claim, the records would have to show that the presumptive drug test, which again could have been performed either by the referring provider in a point of care setting or by ABC Laboratory, yielded 28 unexpected results. So the patient would have had to have tested positive for substances within over 20 drug classes that they shouldn't have been taking, and then not take their prescribed medication from the remaining drug classes to reach a total of 28 unexpected results. And this excerpt is not a one-off. It's not something that we just cherry-picked and it only happened once. ABC Labs was consistently billing dozens of definitive drug tests per member per encounter. And as a result of this billing pattern, they were flagged by Cotiviti's data mining tool on 2 separate laboratory test rules. And those were excessive unique laboratory tests per patient and excessive laboratory test units per patient. So while you can see that something is amiss just by eyeballing the data, the rule hit was able to confirm that ABC Laboratory was a statistically significant outlier from their peers. So in order to corroborate that rule hit of excessive labs per patient, I used Cotiviti's advanced analytics tool to perform a peer comparison. So I queried all paid drug tests in the range of 80320 through 80377 for all providers in all specialties. And then I summarized my data set by specialty, which automatically calculated the number of paid units per patient for each specialty. And the average laboratory was paid for only about 5 individual definitive drug tests per patient, whereas my provider was paid for 97 paid units per patient. And that large discrepancy is in part because ABC Laboratories patients received repeated definitive drug testing visits, but it's also because they received more units per visit. So when we look at the number of paid units per patient per visit, it was only 26.4 definitive drug tests per visit, but the peer average was 3.7 drug tests per visit. So that is, significantly out of line with the peer average. And ABC Laboratory was clearly a large outlier based off of all the data analysis that we performed. So at this point, it was time for us to perform a statistically valid random sample and then request medical records to review. And once ABC Labs submitted the medical records, Cotiviti's medical review team performed a medical review to determine if the documentation supported the services as billed. And spoiler alert, they did not. We found a 100% error rate, and when we extrapolated that out, it ended up being an overpayment of $1,265,000. So for these next few slides, we're going to go over some of the red flags that we were seeing in the medical review. And one of the biggest red flags that we saw was that ABC Labs order requisition form actually allowed for the ordering provider to order both presumptive drug testing and definitive drug testing concurrently. So as you can see on the slide, the ordering provider ordered a urine drug screening, which was then billed with CPT 80307. But the order form does not indicate that the lab should only perform confirmatory drug testing on unexpected results. Instead, the ordering provider has selected the option to order a confirmation panel, which includes all of the tests that were listed on the screen. And then ABC Labs subsequently billed HCPCS GO483, which is the 22 or more definitive drug classes. So this is not an appropriate order. The ordering physician should have either waited until he or she received the results of the presumptive drug panel and then submitted a second drug panel to select only the drug classes that yielded an unexpected result, or the order form should have specified that the laboratory may only proceed to confirmation testing for the unexpected results. So remember, the tests have to be used in the management of the patient's care, and so proceeding immediately to ordering HCPCS GO483 without even seeing the results of the presumptive tests is not appropriate. And our next red flag was providers who were ordering confirmation testing despite receiving the expected screening results. So on the slide, you can see that the screening results show negative results for each of the drug classes that were tested for on the presumptive test. And this patient was a behavioral health patient, not a pain management patient, so they had not been prescribed any opioids, and these negative results were expected. But, despite New York Medicaid guidance that says that CPT code range 80320 through 80377 are only reimbursable for the substances which yielded an unexpected result, ABC Labs billed this patient for 30 unique definitive drug tests using that coding range. And this documentation pattern was seen repeatedly throughout the review. This was not just a cherry-picked example. So if you recall from a previous slide, ABC Labs billed for an average of over 26 definitive drug testing codes per patient encounter, while the average lab billed only 3.7. So the medical review, which consistently showed that ABC Labs was billing for definitive drug tests in the absence of unexpected presumptive results, supported our allegation that the provider was billing for inappropriate definitive drug testing in order to obtain extra reimbursement. And then I've saved the worst for last. We received a medical record from the ordering physician that indicated that she refilled the patient's medication on the date of service, which was the draw date, without waiting to receive the results of the definitive drug test. And the definitive test took 5 days to run from the draw date and the run date, but by that time, the patient was already out the door with a prescription for 100 tablets of Percocet. And Percocet is a combination of Oxycontin and acetaminophen. So, it is an opioid, and it's very troubling that the patient's medical record didn't address this result. and that the patient received their opioids instead of receiving a referral to an addiction medicine specialist. So this was, very troubling, and it suggests that the drugs are not being used in the management of the patient's care.
Yeah, it's an indicator of abuse or, possible drug diversion. So, this stuff, it's contraindicated to cocaine, so they should be dismissed or referred for addiction medicine treatment.
Yep, absolutely. And that's, if you look at the result of 775, that's quite a lot of cocaine that patient tested positive for. So this is not something that we would have wanted to see in the medical records, and it's definitely something that you should be on the lookout for to make sure that that your providers are not letting their patients go out the door with their opioids before receiving the results of the drug tests.
Right.
All right, so to recap, in today's webinar, we taught you how to use data outside of your four walls to share information and then examine the relationships and connections with known bad actors. We talked about using peer comparisons to identify outlier providers. And then we talked about performing a medical review and then some red flags in medical records that you should be on the lookout for. And then how we were able to identify an overpayment of over $1.25 million.